I'm Farber from Boston University, and we have a somewhat unusual topic today that really doesn't necessarily pertain completely to PAH. We're going to talk about posters and poster sessions and why poster sessions are important. And realistically, they're important on different levels to different people. So if we start out with new trainees, so new fellows, or even residents, so they're important because oftentimes this is the first time they ever had something submitted and accepted. It's the first time they're ever going to a national meeting. It's the first time they've had a chance to present their data to their peers, if you will. And it's the first chance really for them to interact and get critiqued by people who are in their field. I actually remember my first poster. It was in Chicago, I think at ATS. I was scared to death. I had no idea what the hell I was doing. Actually, not that I do now, but I had no idea what I was doing. It was great because people would come up to you, they'd talk to you, they'd ask you questions, which most of the time you could answer. And they would tell you that either your work was good, you were doing good, keep going, and stuff like that. So it was actually pretty good. So for trainees, in simple terms, it's an initiation into the field. As you get up farther along, as you say in your second, third, fourth year fellowship, whatever, it starts to get more important because it's a way to get your name known. So essentially, if you're looking for a job, for one, and two, if you're trying to or thinking about staying in the field that you're doing the work in, then it's a way to get your name out there so people know who you are. In addition, they can then judge for themselves how competent they think you are by how well you handle yourself at a poster, how much information you can give them, how well you answer their questions, stuff like that. And then as you go farther along, say when you get to be attending level, certainly starting out, now you're in the field, for example, and it's a way to get not only more known in the field, but to interact with people who have interests that are close to what you have. Then as you get farther up, maybe posters become social. You know, you hang out with poster sessions. Most of the people there are people that you know or have worked with or have interacted with. You look at the posters and it's social. You're sort of schmoozing. And also, then it's a way for you to pay back, to go see posters of people who are starting out younger, etc., and see what they're doing, encourage them, whatever. Lastly, where there are posters where there are patients, it's a way for patients to see, one, what's going on, what's essentially new in the field, because they're always asking you, what's new treatment, what's new whatever. So this is a way for them to sort of get a rough idea what's there. Plus, other than their doc, it's realistically the only time they get to interact with other people who are supposedly well-known in the field and or can impart sort of a different knowledge to them. So it's different things for different people. For the meetings, it's actually good because you can have a lot more people present than you could if everybody was trying to give a talk. There's just not enough hours in the day. So you can have a ton of information that's grouped by specific topics presented at a meeting. No matter who you are, whether you're a physician, patient, just starting out, think you know everything, etc., the more information you gather and the more varied the information you gather, the better off you are. And the better you can presumably carry out what you're supposed to be doing, which is taking care of patients. I'm Farber, and I'm aware that I'm rare.